Hello, I'm Dr. Jon Perlman, Beverly Hills plastic surgeon and plastic surgeon for ABC TV's Extreme Makeover. I wanted to spend several minutes talking to you about liposuction and answering some of the most common questions that I receive. Liposuction is a wonderful technique to thin the fat layer, the padding beneath the skin. It has no effect on the fat inside the belly cavity, so you still have to keep your weight off and watch your diet and exercise after the surgery. But it's a great tool to take inches off if you do have a thick layer of padding immediately beneath the skin on your body. Many areas are amenable to liposuction and have been helped, including the commonly known areas, the stomach, the hips, the thighs, the knees, even the calves. But lesser known areas include the neck area, the submental area below the chin, and the arms. These are two areas that can really make a big difference, both for men and especially for women in the arm area, since women hate to put their arms into a sleeve and feel that their arms are bulky, whereas men take that as a sign of being muscular. So liposuction can very effectively thin the layer of skin and probably stimulate a small degree of skin shrinkage. But for the most part, the loose skin is going to remain present. That's where the interesting addition of new therapies, including RF energy treatments such as iLipoExcel, just about now becoming available, can stimulate some degree of skin shrinkage to add and contribute to the quality of improvement following liposuction. Well, how is liposuction done? Well, through small incisions, tiny cannulas are inserted that inject adrenaline highly diluted in a saltwater solution or saline solution to make the fat cells swell up. That also serves to shrink the blood vessels, so there's much less bruising and blood loss during liposuction, making it an easier recovery as well as a safer procedure. There still is a safe limit to how much can be removed, and under those rare unfortunate circumstances where you hear of somebody suffering severe complications following liposuction, it's usually somebody taking an extreme dangerous chance and risk and doing many, many hours of huge volume liposuction, and I strongly recommend against that. It's ill-advised and too dangerous and shouldn't be done. Very few board-certified plastic surgeons would even consider a procedure like that. So once we inject fluid, the blood vessels shrink, the fat cells are expanded, and a small cannula is inserted through the incision that enables us to carefully and accurately remove fat in the areas desired. We don't want to leave too much behind, but we also don't want to take too much out for fear of causing rippling or dimples. It's experience that teaches the plastic surgeon who is a good candidate for the procedure and who is at risk of having loose skin or ripples or dimples that may be unsatisfactory. I do unfortunately see people who've come in and had too aggressive liposuction done, and they have loose, irregular skin that just looks awful, and it's ruinous. It's just a terrible mistake. So it's very important that proper judgment be used and reasonable expectations be expressed to the patient. Some people are great candidates, especially younger people, people with good skin elasticity and a thick padding. But poor candidates would include people who have perhaps diabetes or other illnesses, who have gained and lost a lot of weight and primarily have loose skin and not so much fat padding. There's little to be accomplished and potential problems with it. So what can be achieved? Well, as I mentioned, we can improve the contour of the neck. We can make arms feel much smaller when they're inserted into sleeves. We can make tummies much flatter, the hip rolls or the grab handle area. I've had patients come in who had no hourglass shape to their figure undergo liposuction and develop an hourglass figure for the first time. We can also help the proportioning between the upper and lower portions of the body by liposuctioning the saddlebags, the hip rolls, and the inner and outer thighs, making upper thighs look leaner and longer. I also like to sculpt the area above the knee, what we call the suprapatellar area, and the inner aspect of the knee to shape these areas. Less commonly, we see patients who store a lot of fat in the lower half of their calves above the ankle, and that can provide a remarkable change. All of these examples are present on my website at perlmanmd.com. Just click on procedures and then liposuction, and you'll see many examples. You're also welcome to call us if you'd like to schedule a consultation so that you and I can meet in person and discuss the multiple ways that I may be able to help you to feel better, trimmer, and look better as well. But keep in mind, after liposuction, it's your responsibility to keep the weight off that we've removed if you want to maintain the optimal outcome and result. Please call us if you have any questions or email me, jonap@ucla.edu. I'll be happy to correspond with you. Thank you so much for your time. I hope you enjoyed this.